afternoon, Dr. Dinesh and
Good
Dr. Ilya.
Just 1 minute.
Good afternoon, Sharon.
Please check your audio and video.
Yeah, 1 second. I'm getting my.
Sure, sir.
So video is working fine, and I guess you can hear me. So audio is also fine. Thanks.
Yes. Thank you, ma'am. We'll start at 4.
Sure.
Okay, can you hear me?
Yes, sir.
So video is working also.
Yes. Thank you so much. We'll start at 4.
Sure.
फिर आप क्या
कोई बात नहीं। कर दिया ना। ये अच्छा मिरर होता है एक दिन।
Good evening, everyone. A warm welcome to the 26th webinar of the webinar series on adolescent and youth. I'm Sharon Augustine, moderating the webinar on pedestrian safety. Here is a survey on your screen. Please fill it, and it is also open for the panelists as we wait for the more participants to join in.
evening, everyone. I, Aliza Hassan.
And I'm Sharon Augustine. We will be moderating the webinar today. I once again welcome all the panelists, principal teachers, public health professionals, and especially the health ambassadors. Because of the demand from audience, we have the webinar interpreted in Hindi also. Those of you who wish to listen the webinar in Hindi, please click on the Hindi interpreter on the bottom of your screen.
Thank you. Let me all introduce you with CHAP. CHAP stands for School Health Annual Report Program. It is a non-governmental pan-India health organization, and we have recently completed 21 years in this field. We work for the healthcare of students and children, which is professionally managed by eminent psychologists, educationists, counselors, and people like you and I who have vision to promote healthcare.
Walking or cycling from school to home every day is the best memory we have of our childhood days. But it is one of the risks a child takes every day in his or her life. Walking on a footpath in India is not less than an obstacle race, as it is mostly covered with street vendors, small shop filled with potholes, or some construction going on, residents parking their cars or bikes on it, and when there is heavy traffic, bike starts riding on the footpath, causing a threat to the pedestrian's life.
COVID-19 has left a big room to discuss over the subject. For the same objective of discussion, we here have with us our esteemed panelists, Mr. Dinesh Mohan sir, Dr. Ilya Jafar, Mr. Vikas Mohapatra, and Ms. Usha Sharma. We welcome you all. A few instructions before we go further. We will let each panelist speak first, and then we will have a question and answer round. All the questions in the Q&A will be taken live. Please drop questions in the Q&A box with the name of the panelist you want to ask to. The sharpest question from the audience will be given a gift hamper of rupees 1000 from CHAP. Also, I request all the attendees to not flood the chat box with unnecessary questions so that we tend to miss the important ones.
Without further ado, we invite our first panelist for the day, Dr. Dinesh Mohan. Is a professor at IIT Delhi and also the director of Independent Council for Road Safety International. He is a leading expert on traffic safety issues and human tolerance to injury. From 2010 to 2015, he was Emeritus Volvo Chair Professor for Transportation Planning and Safety at IIT Delhi. He headed the Center for Biomedical Engineering and coordinator for the Transportation Research and Injury Prevention Program. We welcome you, sir. Glad to have you here. Over to you.
Thank you very much. I'll go straight according to your instructions, and you have sent us some questions. So I'll first just answer them first. Your first question was, should there be more overhead bridges and underpasses around schools? I'd like to give you the international experience that no one in the world uses underpasses and overbridges. As a matter of fact, overbridges, underpasses have been banned in all civilized societies unless there is a lift there to take most 30% of the people who can't climb steps or climb down steps. Secondly, most women hate overpasses and underpasses because it is very unsafe for them. So the question of overbridges, underpasses does not arise unless you have expressways or 8-lane roads or 6-lane roads which cannot have traffic lights. But then you have to put hawkers on the overbridges, underpasses, along with the lift, so that there's no crime there. Because a lot of overbridges, underpasses are populated with all kinds of people who bother women and children. And so unless you have hawkers there, the police can't do the job. CCTVs are useless. We know from international experience that CCTVs do not reduce crime anywhere. They just make money for governments and the manufacturers. So second is street vendors. Street vendors are essential in India because if you don't have street vendors on our roads, no women can use the road. And the street vendors are the people who give complete safety on the roads. The government doesn't have to pay them. And when something happens on the road, it's the street vendors who give all the information to the police. So the potential criminals know that the street vendors are eyes on the road of the police. and the municipality. And so wherever there are street vendors, children and women can walk safely. And they also give you goods cheaper, which no shop can give you. Uh, International testing of bacteria shows that hot food sold by street vendors has less bacteria than middle class restaurants. So it's very healthy to eat from hawkers, at least the cooked food. So that's it. If you want children to walk, if you want women to walk, you have to have street vendors on the road and you have to provide space for them. And according to our surveys, in all cities of India, there's enough space if you use all the space on the road every 100 meters or so. Two-wheelers run their vehicles on footpath. There's nothing you can do about it. Education has no value. Uh, you educate people when they don't know something. Every motorcycle driver knows he's not supposed to be there. So what do you do by educating that person? It's absolutely useless. It's like telling college-educated people that 2 plus 2 is 4. Um, so the whole issue is if there are people on motorcycles on sidewalks, you make it difficult by design for them to go onto the sidewalk by putting bollards and other things. And secondly, constantly advertise that that pedestrians should stand in front of the motorcyclists and don't let them pass. Do dharna. Make it difficult. Call the cops. And forget about education. You have to vote with your feet and your hands that this is my space. So the next question was on overbridges, underpasses. Uh, I've already dealt with this, so I'll pass that. Uh, the only thing was, if you have to have overpasses and underpasses, to say that you should have them frequently, we won't have that for a long time. They're very expensive. They cost crores. The reason the government builds underpasses and overpasses is because it makes a lot of money for everyone. They don't serve much useful purpose. And secondly, underpasses and overpasses get locked at night. So how do you cross the road then? So, for example, where I work in IIT, there's a underpass, and which gets locked at night because there is too much crime, and there's a huge fence in the middle. Then how do the students cross the road at night? So it just shows that the upper class of this country is so insensitive that they don't care for women, they don't care for children, because most of the people who are walking late at night are men. And so it just shows that the upper class of India does not know what's happening on the road, and they don't care. They don't care about the women in their own family and the children in their own family. And it's a very serious issue. Next is challans for red light jumping for pedestrians. You know, if it doesn't work for car owners, why do you want to bother pedestrians? Just make it possible that there are red lights everywhere for pedestrians to cross, and they get enough time to cross. And you have enough crossings. By the way, in the city, for example, New York City or Tokyo or Paris or any city, on the roads inside the city, the speed limits now are either 30 or 40 kilometers an hour. And we are so backward that our speed limits are more than 50 in most of our cities. And secondly, in New York City, there's a red light every 300 meters. So if you have a red light or in Paris, or in London, or in Tokyo, so if you have a red light every 300 meters inside the city, then the pedestrians will cross it quite happily everywhere, and people and car owners will not be in a hurry. So if you are worried about pedestrians and children, we have to say that you have to have a red light at least every 500 meters, if not 300, 400 meters. And because cities are for people, they're not for cars. Cars happen to be there, but there would be no city if there were no people. And we should also know that in all cities of India, approximately 40 to 50% people go to work walking. In Bombay, 44% of the people go walking to work, and only 17% by the local train. In Delhi, only 4% of the trips are by metro, more than 30% by walking, and about 10% by bicycles. So if we think we are a democratic country, then the road should represent the democratic space. if 30 to 40% people walk to work in every city, then it is incumbent on the government to give at least 1/3 of the space on the road to pedestrians. It's a democratic right. If you don't do it, it shows you're not a democracy. It's as simple as that. You can judge every country in the world by looking at the road, on how it is made for people. Um, as far as zebra crossings are concerned, we know from studies done in Europe that children, and especially children, but old people and children, and even others, have a higher likelihood of getting killed on a painted zebra crossing. So painted zebra crossings are very dangerous for children because children think they are safe and they become more careless. And some car owners and bus owners sometimes for many reasons don't stop. So if you want to have safe pedestrian crossings for children and older people, either it should be what we call the platform, which is like a very, very wide speed breaker, which is about 12 centimeters above the road. And you can see them in many places in Delhi now. So unless a pedestrian crossing is raised by 12 centimeters, it is not safe. The zebra crossing is very dangerous. Or the only other option you have is to have red lights. There is no other option for people crossing the road. And in small areas where there are schools, there have to be people, teachers or adults standing there stopping traffic. And once this system happens, people have to respect others who are protecting children because that's a genetic reason to do it. All over the world, older people protect children as a genetic, intuitional aspect of things. And we have to promote that genetic intuition of people to respect children's rights. You have a question on what is the right way to walk on streets. If it's a narrow street, then you walk facing traffic. If it's a wide street, you walk anywhere on either side. Because I don't want, if you say which is the correct way, I don't want children to be crossing the street to walk the right way because they might get killed crossing the street. So if it's a wide street, walk on whichever side you are. If it's a very narrow street, like in your neighborhood, then walk facing traffic. Most streets lack adequate lighting and vehicle owners have broken headlights. Actually, we've done a survey, very few cars have broken headlights. Most people whose headlights are fused get them repaired very quickly because they themselves feel unsafe. But our streets have very bad street lighting. And if you're in Delhi, if you want to find out what is the correct way of a street light, you go to the old BRT because our street lights are very high, which is an absolutely wrong design. Because the street lights are very high, the light does not fall on the footpath because there's a tree there. So what they do is the street lights light up the road where the cars have headlights, but they don't give lights on the footpath where people walk. So what you have to do is you have to have lights below the tree branches on the footpath. And there are designs available for that. So these have to be, if I see there's so many people attending this webinar, things don't happen because engineers and governments are nice people. Things happen because people demand things of the government like the farmers are doing now. So it's very, very important that all of you who are interested in children's or pedestrian safety start demanding. If they don't listen to you, then children have to go and sit down on the road with their parents, that this is a safe, unsafe road. So this is how it has happened all over the world. Please remember, nowhere in the world have the engineers responded or the government responded to such concerns because motorists are very powerful. Unless the pedestrians and children and the parents make a demand, which is politically important, to make it difficult for IAS officers and IPS officers to operate unless they listen to you. And I think this is terribly important if you want better streets for our pedestrians. And lastly, about vehicular improvements, all our vehicles have to follow international standards now. So there's not much you can do to get something different. All you can ask for is that no vehicle, whether it's a three-wheeler or a car or a truck, should have anything added to it which the manufacturer has not put there. You can't have any hard or pointed object in front of a vehicle. You can't have a bird. You can't have a image or a statue of a god or goddess, because those are hard things which can break the jaw of a child. And so, if you are looking for the future, the automatic emergency braking for all cars is going to become compulsory by 2022 in Europe and the US. And we should say that the Indian government should start testing and asking the manufacturers to say how that will work in India, and to say that the automatic emergency braking should come to India, say by 2025, 2024, whatever. Thank you very much.
Thank you so much, sir, for sharing your bright insight over the subject and how you have thrown light on street vendors. It is a very simple form of existence we see each day, and how they're helpful in terms of safety and being economical at the same time. Thank you so much, sir.
Thank you.
I would like to welcome our next panelist, Dr. Ilya Jaffer, currently working as a Chief Program Officer at Save Life Foundation, having a rich experience of more than 18 years in the field of humanitarian and development sector. Also, serving as a senior advisor in SPARE India. She is also an alumnus of International Visitor Leadership Program in Disaster Management. She has also worked with CARE International, International Federation of Red Cross, and IFRC and UNDP as well. Over to you, ma'am. We welcome you.
Thank you very much, Aliza, and really happy to be a part of the panel with such esteemed members, Dr. Dinesh and all others. Just in the interest of the participants, and I see there are a lot of school children also, which is really so good to see the kind of engagement with children posting all their questions in the chat box. I would like to therefore start with a presentation, starting with some statistics, which I'm sure the students will find really helpful, and then going into what are the issues and how perhaps in my organization Save Life, how we have been trying to address that. So I'll start to share the screen. Is my screen visible?
Yes, ma'am.
Okay. So this, I'm sure for whoever has come for the seminar understands that India is topping the world, not for anything great, but for the being the highest in number of road crash deaths. Every year we have around 151,000 people killed and almost 1 million injured. Over 50%, as per various researchers, has been said that over 50% fail to receive care within the first within the golden hour, the first 2 hours, as we say. And there was also a study by World Bank which says that the economic impact of such deaths is almost 3% loss of GDP. Now, this, the latest report of MORTH, which is released in 2019, shows a kind of encouraging scenario when you see that the road crash deaths and injuries, the blue one is showing the number of accidents, the red line is showing the number of deaths. You see that it was increasing till 2010, and then it has kind of plateaued, maintained, or slightly going down. Seems that things are good. But if you look at what is happening with the pedestrian deaths, then you will see an increasing trend. Despite a decrease in deaths and injuries overall, the number of deaths in vulnerable road users is increasing, and pedestrian deaths have been significantly increasing. Even if you see from 2018 to 2019, there have been almost 14% increase. And if you compare the number of deaths in 2016, which was around 15,000, to 2019, which was 25,000, it's almost like 64% increase. So this is a situation of a grave concern. Now, just to give you a sense, when we said 25,000 people died in 2019, what does it look like? So this is just an image of the FIFA World Cup opening day, where 25,000 people gathered. And this is the kind of number we are talking of, people who are losing their lives on Indian roads. Pedestrians only, not the entire loss of life. So pedestrians are, this is the kind of impact that's happening. Now, when we look at the age-wise breakup also, you see that here again, maximum lives were lost in the age group of 18 to 35, the really productive age when students are just coming out of school and college, entering college, getting ready for work, and that's where lives are being lost on roads. And there are 31 child deaths every day. So when we are talking of pedestrians, again, we have to understand that this is not a homogeneous group. Within pedestrian, there are different age groups, and the impact and the lives lost are also varying for different age groups. And therefore, perhaps if we have to do some interventions, which is the group we should be focusing on, is clear from this. Now, if you look at cause-wise split, again, speeding ranks the highest. 67.3% deaths are caused due to speeding. The other top factors being driving on the wrong side, drunk driving, and using of mobile, which is distracted driving. At Save Life Foundation, which was founded in 2008, we have been looking and trying to work at two levels. We've been operating at both the policy and advocacy level as well as on ground to bring a change. We work at the intersection of the both. Our foundation of everything that we do is research. So whatever we do is evidence-based. A lot of research, studies, crash investigations, FIR coding is done. And based on what evidence we get, we are doing advocacy and engaging with government and policymakers and public at large, then communicating effectively to bring a change, and then actually doing things on ground to develop a proof of concept. When we say that accidents or road crash deaths are preventable, we have to show it on ground, and then only people will understand that this is what we're talking about. So that's where Save Life's work actually focuses. Now, since I talked about Okay, so when we talked about the causes, what are the main causes or the factors behind such road crash deaths or fatalities? One of the prime cause is lack of rapid trauma care. As I said, as per one of the reports, 50% of road crash deaths are happening because of not getting or not accessing emergency care within the golden hour. If that is done, that alone will save almost 50% lives. So why is that happening? When a study was done by Save Life to understand what are the impediments to bystander care in India, we understood that 74% were unlikely to come forward to help a road crash victim. Why? Because there was hesitation that maybe police there'll be hassles with police, or the hospitals might ask for payments, and people really didn't want to do that. 77% people attributed their hesitation to the hassles related to the hospitals. So this led to doing something, and we started with filing a PIL in Supreme Court in 2012. That was followed by a lot of engaging with a lot of people, engaging with parliamentarians, ministry. Even after all our efforts in 2015, starting from 2012, engaging in various ways with different stakeholders. In 2015, MORTH published the guidelines for protection of Good Samaritan, and then 2016 we finally were able to achieve what the guidance that Supreme Court said, that a Good Samaritan law will be imposed. And then in 2016, post the Supreme Court order, Karnataka introduced a bill for protection of Good Samaritans and medical practitioners from any civil and criminal liability. That was the journey taken, and post that in 2018, Honorable President provided assent to the Karnataka Good Samaritan medical professional regulations. And in 2019, government of Rajasthan also published a notification mandating the adherence of Good Samaritan guidelines for hospitals and police officials. You might have also, those who are familiar with Motor Vehicle Amendment Act, you would have seen that there is a clause which says that Good Samaritan have to be protected. So this is just clearly showing a journey of how protection of Good Samaritans is guaranteed by law now after all this effort. Now there is no hassle, legal or in medical terms, if anyone steps forward to help someone injured. You are not even supposed or mandated to tell your phone number or anything. You just can hand over. So every listener here, I would appeal that in case you come across any road crash and anyone is lying, please don't hesitate in offering immediate support, at least calling the ambulance or doing something so that within the golden hour emergency care is provided. There were also a lot of basic trauma life support training programs that we did, because we realized that who is on the scene first? Mostly people call police and the PCR van reaches there. But these police officials were not trained on how to do the initial first aid or how to do the basic trauma life support. And they were essentially just transporting the victims to the hospitals. So training them on BLS has now definitely increased the first aid or giving the trauma life support to the injured people whenever police reaches them. Now, the second part, which is enforcement, and now I know in the chat box also, Haransh had asked a question that why is it that when there are no lights, when there is no police, people do speeding, but when there is police, people will be following speeding norms, people will be wearing seat belts. So the whole thing is that enforcement is a key to getting a change happen. Without enforcement, this is a behavior. I think people mostly live in a denial mode. Everyone thinks that, okay, this happens all around. We read it in news, but this won't happen to us. And therefore, because of the denial mode, we don't tend to do it or to wear a seatbelt or to wear a helmet. We do that only because of the fear of challan. And therefore, enforcement is important. If you look at the provisions in Motor Vehicle Amendment Act, you will see that now there are provisions which also focus on better enforcement, since there were issues of corruption in enforcement of many times police just challaning, taking some money. So now there is also a provision for electronic monitoring and enforcement of road safety. Besides the MVAA, in which Save Life also had been working closely in terms of drafting the law and all, we also, along with the Maharashtra MSRDC, have, as a part of our project on Mumbai-Pune Expressway, introduced patrolling vehicles, and you can see the photograph of the patrolling vehicle. And besides advanced patrolling, we have also installed intelligent traffic management system, due to which challaning has increased and there is better enforcement. Another example of how we can address or understand road user behavior and perhaps improve the road infrastructure, a very low cost kind of intervention, quick intervention, is to try urban design, tactical urbanism trials. And this is just one example which was done in Bhalaswa Chowk area on a stretch in Delhi, outer ring road. You see the stretch that we worked on started from Mukarba Chowk to Signature Bridge, where all the junctions were studied closely. And the methodology followed was starting with the survey of understanding pedestrians, their behavior, what is the volume and all, then doing a research globally, what are the best practices. Based on the global practices, understanding what is the local context, making some recommendations, making some changes on the junction and on the road. And then based on how those changes interacted with people's behavior, making recommendations for the permanent change. Just quickly showing you how it looked like. For example, initially the Bhalaswa roundabout looked like what you are seeing right now on the screen. These were the issues. The provided crossings were very far from the junction, so pedestrians were actually crossing from wherever they felt convenient. Many footpaths were unfinished, and therefore like if you see, there was a block while there was a path made for pedestrians, but something was kept there so people couldn't walk there. So they were walking on the road. And the third was even the highway underpass, because it was so hot, people were using that just to sit there, relax, talk and all. It was a lot of creating a lot of risk. There were a lot of other issues also, vehicular issues, infrastructure issues, but since this session is focusing on pedestrians, I've just covered 3. And just to give you a glimpse, we can definitely, those who are interested, talk bilaterally separately, but what it looked like before is on the left side, and post the intervention on DU, this is how it looked like. And that's why there was avoiding of conflict, road user conflict. Pedestrians had their own path, cyclists had their own path. The zebra crossing was moved slightly closer to where people were actually crossing. And this did bring a significant change. So that's something that was piloted. Besides that, we also saw that speeding was one of the highest cause of fatalities. Similarly, hitting concrete objects because of speeding, losing the control was happening there. So some of the engineering interventions done by Save Life are, for example, addition of what you're seeing on the right side is crash barriers. So introducing different types of crash barriers depending on what kind of situation, looking at the gaps in medium, closing them. And you must have seen in Noida, those of you who visited, all the medians are being, the height of medians is being increased so that people don't cross anywhere. They only cross through the designated place. So such interventions also make a big change. In terms of road user behavior change, a lot of radio campaigns, a lot of nukkar nataks with schools and also were done. A lot of toll plaza engagement with people, making them aware was done. And we have some evidence of how certain violations have been reduced. These were very briefly, I'll stop sharing my screen so I can see in case there is any question in the chat box. Okay. Or maybe Sharon and Aliza, you can let me know if something I've missed. But otherwise, this was very broadly touching on what the situation is and how it can be addressed for pedestrians. I'll stop here and looking forward to hear the other panelists also. Thank you very much.
Thank you so much, ma'am. Thank you for sharing the statistics regarding the road crash and all, and especially the factors for road crash and how about the Good Samaritan, throwing light on the Good Samaritan law and the provision under the Motor Vehicle Act. Thank you so much, ma'am. So our next panelist for the day is Mr. Bikash Mahopatra. Presently, he is working as Secretary of NGO Forum for Prevention of Road Accidents and implementing road safety programs to increase awareness and tactical skills among road users in India. Besides education, he is also involved in promoting advocacy on issues related to road safety, in influencing, informing, and assisting decision and policy makers. We welcome you, sir. Over to you, sir.
Thank you very much. Are you hearing me?
Yes, sir.
Yes, sir.
Just I want to share my screen, so then I will start my presentation.
Sure, sir.
Now it's okay?
Yes, sir.
Okay. So thank you very much, sir, for inviting me as a speaker to this webinar. Actually, our organization, Forum for Prevention of Road Accident, is an NGO and which is working in Odisha and other neighboring states for last 15 years. And we are actually focusing on, safety of school children. And most of our projects are based for the welfare of the children and their teacher, giving them training on traffic education and all other things. I have divided my presentation into two parts, two small parts. Hardly it will take 10 to 15 minutes. First I will speak about my organization, what type of activities we are doing for the children and other road users. Then I will also share one of my experience, because recently we have implemented one project, that is Safe School Zone. And this is a success story for our state. So I will share those slides for our viewers. We established, this is a very small organization, and we established this organization in the year 2005 with a group of people, youngsters, those who are committed to do some good for the road users. And it was the first organization who started traffic safety project in a professional manner in our Odisha state. And we have implemented so many projects during this 10 to 15 years. And we are focusing in Odisha, West Bengal, Chhattisgarh, and Madhya Pradesh. We have some project in different districts. We are collaborating our project with different organizations. There are so many corporates, those who are actually supporting and sponsoring our project. There are also state government, central government, other authorities, those who are actually associated with this program, with our program. So traffic safety project is one kind of very unique project, I can say, and it has been implemented in Odisha and West Bengal. There is a national highway, and we are trying to actually minimize the road accident on that national highway 60. And it was supported by Island FS Transportation Network Limited, and there's a number of program has been taken up under this project. Another project is a very unique project because we are using some tools to educate school children. You can see those tools are hands-on activities we are doing to give training on traffic rules and regulations. One of our best project was in Fit for Road Safety campaign. It is supported by the HPCLs, and we are implementing this project in Chhattisgarh, Odisha, and West Bengal. Come Back Home Safely program, because we all concerned about the safety of the children. We are all parents and family members, they are worried about their children because they are sending their children to the schools, and with the hope that their children will come back safely. But unfortunately, there are many cases in which the innocent children have been killed on the road. So it was a project in which actually we implemented this project around 300 schools of Odisha states. A safe school zone is an important concept. It has been promoted by WHO, and we can also discuss this project later on. There are so many projects we are implementing, but I want to just focus on our latest project, that is safe school zone, and that is safe school zone. That in the school area, because we are focusing on the rural area, there are many schools which are very close to the national and state highway, even in situated inside of the national district roads. So they are vulnerable to the road accidents because there is no provisions of neither you can find any safety safety information, road signage, nothing. Because we have adopted one school that is in Cuttack districts. That school was very close to the state highway. उस स्कूल में क्या हुआ कि एक दिन इतना बड़ा एक्सीडेंट हुआ जिसमें एक लड़की का मौत हो गया on the spot. Then the school decided to start this project with us. They contacted us, and we have decided to start this project from that schools. And we actually, what we did, we first organized one, teachers training program on safe school zone. We invited so many teachers from different schools, from the government and private schools, and we involved also transport commissioner and traffic safety department of our states. We invited also some NGOs from New Delhi and Mumbai. Then we started this project, giving them training, and हम उन लोगों को क्या किया कि हमने इस कंसेप्ट के बारे में पहले बात की, क्योंकि सेफ स्कूल जोन जो प्रोजेक्ट होता है, स्कूल की जो एरियाज है उसी एरिया को कैसे सेफ रखा जाए, क्योंकि जितने भी हाईवेज है, जितने भी मतलब गांव की एरिया है, वहाँ ये प्रोजेक्ट इम्प्लीमेंट करना काफी जरूरी होता है. लेकिन गवर्नमेंट इस प्रोजेक्ट के ऊपर इतना ध्यान नहीं देते हैं, क्योंकि एक्चुअली ये तो काम नेशनल हाईवे अथॉरिटी का होता है जो सड़क बनाते हैं, लेकिन सड़क बनाने वाले उसी चीज को कभी ध्यान नहीं देते हैं कि पास में एक स्कूल है और स्कूल के बच्चों के लिए हमको सेफ स्कूल जोन डिक्लेयर उसी एरिया को करना चाहिए. इसी ऊपर एक ट्रेनिंग होने के बाद हमने वी हैव स्टार्टेड actually a training program with Global Alliance of NGO Road Safety. Some of our members, they were selected and participated in that program, and they built their capacity to implement this project. Then we decided to have start this program in Ratnakar Vidya Mandira. That is the school which is very close to NH 16. First, we decided to have a survey to know the situation of that schools, how the children are vulnerable to this, environment. Then we decided to involve some of the technical persons to conduct the survey. We first did a survey, and after finding, we came to know that there is, around 2,342 motorized vehicles are moving on the highway, during the peak hour. The quantity was very huge, and due to this, and this was the single road. So, and there is no such road marking is not there, even road signage are not there. There are nothing, and although it is owned by the state government. Then we started discussing this matter with the Transport Commissioner and Director of the Secondary Education of our states. They agreed on our points, and we submitted our findings to them. And we also recommended some of the points how to make the school zones safe. So they agreed, and they actually astonished to know that as though it is a responsibility of the National Highway Authority, but why they are not actually making it safe, because they are actually giving contract to different contractors, and contractors are avoiding this state because there is a mandatory provision. उनको करना चाहिए, नेशनल हाईवे अथॉरिटी वालों को जितने भी स्कूल है हाईवे के पास सबको सेफ स्कूल जोन डिक्लेयर करना चाहिए। वहां जितने भी जरूरत है, जो रोड मार्किंग होना चाहिए, जहां साइनेज होना चाहिए, वो सब उनको करना पड़ेगा, लेकिन वो नहीं करते हैं और लोगों को इस बारे में कुछ पता नहीं। So when we started research on that, we came to know that there is a provision, it is a mandatory provision, they have to do this. And we discussed this thing to our higher authority. And fortunately, they agreed on our point. They recommended and demanded various things. They wrote letter to the concerned department and involved different stakeholders to declare this zone. And you can see those pictures by which you can know that before implementing the project, first what was the condition of that area, and after implementation project, how you have changed it. It is a rural area, and it's a remote, I can say it's a remote rural area. पहले देखिए आप एक फोटो में आपका वहां तो साइनेज बिल्कुल नहीं था, रोड मार्किंग बिल्कुल नहीं था, और जितने भी मतलब बुशेस है, ब्रांचेस है, ट्रीज है, उस स्कूल के सामने पूरा भरे पड़े थे। और इतने सारे काम हम करके उसको एक्चुअली एक ने डॉक्यूमेंटेशन बनाया और उसके बाद उसको हमने गवर्नमेंट को सबमिट किया। अनफॉर्चुनेटली government is now recommended this thing from almost all schools, mostly the government schools, those who are situated very close to the national highway. This was the project. It is not only for, I am speaking because I have implemented this project in rural area, but this project can be implemented in urban also. So in Delhi and other metropolis cities, this project is very much essential. And I think through this webinar, I would like to request all the participants, they should demand before the authority to make their schools safe. Thank you very much for giving me the opportunity. Thank you.
Thank you so much, sir. We are so glad to hear about the initiatives taken by your organization to safeguard people on roads, and most importantly, how vulnerable section of society is taken into consideration. Thank you so much for your valuable views. I would like to welcome our next panelist, Ms. Usha Sharma. Ms. Usha Sharma, principal from SRN International School, Jaipur, has done Masters in Commerce and Masters in Commerce for Business Administration. She has also been a receiver of more than 25 awards in the field. We welcome you, ma'am. Over to you.
Thanks, Aliza, for your affectionate gesture. Pleasant and blessed evening to one and all. I, Usha Sharma, Principal SRN International School, extend warm welcome to adorable students, esteemed parents, versatile mentors, and visionary speakers. I'm extremely grateful to the executive body and team members of Sharp NGO for providing golden opportunity to speak on the awakening topic, that is the pedestrian safety, motor vehicle and pedestrian collision. And walking to school, let's start. Walking to school, who are the pedestrian walking to school? Students, escorting parents, mentors, and help. In fact, we all are pedestrian. Suppose we are going to the market just to procure anything. We are just walking to the market and we are coming back from the market. So we all are pedestrians. And walking is a common mode of transport in all the societies around the world. Walking provides us health and environmental benefits such as increasing physical endurance, keeping us fit and healthy, reduces heart and obesity related diseases. Many countries have started offering incentives to encourage walking as very important mode of transport. Unfortunately, in some situations, increased walking can lead to the risk of road accidents, causing pain, injury, and sometimes loss of life. Due to the economic growth, number of motor vehicles and their utilization around the world has increased, inviting threat of minor and major accidents if road safety rules are not being followed. Pedestrian collision is further heightened when traffic laws are not followed and enforced. Reasons for motor vehicle pedestrian collision: high speed of the motor vehicle, driving under the influence of alcohol, lack of pedestrian facilities like pathways, walkways, and zebra crossing, poor visibility of roads. Like Dr. Dinesh Mohan has insisted that we are having poor visibility on these roads. Certainly the students are going to school during daytime, but sometimes during evening, they are going to the nearby places just to develop their life skills, just to practice the life skills, to learn dance, drama, music, and theater. So poor visibility on the roads, children are suffering badly. Again, pedestrian collision is there due to driver fatigue and unsafe driving of new learners. Pedestrian distraction is also there due to mobiles, video games, and earphone. While walking, they are on mobile. I am just discussing in respect of students being a principal of this school. Due to this vehicle conditions and defects, fragile this brakes, fragile lighting, and windscreen. Now, what is the solution for this pedestrian safety? There must be awareness campaign for traffic and safety rules in every school. And the children must be given instruction while crossing the road: stop, look, and cross. Do not run on roads, because we are having the students right from 6-year-old to 18 years old. Parents can take the responsibility by rotation to accompany the group of children. If they are walking to school, a children of particular this locality can come in the group, and accordingly by rotation, this responsibility can be taken by the parents, that I can escort the group of the particular society in the morning and other parents in the afternoon. That will be good, because we have to just take care of the safety of the children. On narrow roads, children must be very, very careful. Pedestrian crossing must be used. Walkway and pathways must be used to cross the road. We are not having sufficient walkways and bicycle lane in our country. That I appreciate. Sharp NGO is playing important role in awakening and planning of marking of specific lane for pedestrian and cyclist. Children should be advised that they should not use mobiles while on road. Complete attention on road. They should not try to play with any toy or device while coming back from school to home. That we have been addressing our students during assembly also. Sincere, they must follow these traffic rules very sincerely, as it is a question of their health and life. Public local transport must be restricted in residential, educational, and in medical areas, and children must be careful about it. Moreover, must have basic knowledge of insurance coverage. Children should also have the basic knowledge of this insurance coverage. Sometimes, if any collision is there, then every time, suppose there's a mistake of this pedestrian is crossing without just looking left and right, then there's no fault of this four-wheelers. So the child should know this thing, it is my mistake. Or sometimes child mistake is not there, the mistake of the four-wheelers is there. So we should know about this insurance coverage. If due to our mistake, if any loss is there, then our insurer will compensate this loss. If we suffer due to the mistake of any motor vehicle, then the insurer of this motor vehicle will be paying these expenses. So this basic knowledge children should also have. In our curriculum also, awakening topics must be included. Though we are having these topics in social science and in science, but it should be a formal subject with proper evaluation, and performance must be depicted, and that should be in respect of art of saving life. So awareness must be there in respect of traffic and safety rules, in respect of POXO Act, in respect of knowledge of firefighting equipments, first aid treatment also. Art of saving life. This is the art of saving life. That's all, dear. I really just bless you all, my dear children. Keep following road safety rules. Keep transforming your dreams into reality, and keep making your society and planet. Thank you very much.
Thank you so much, ma'am. Yes, sir.
Uh, can you hear me?
Yes, sir.
Thank you very much. I didn't want to interrupt, but I just wanted to make a couple of things which are important clear. Number one, that we must not trust the government statistics. The Ministry of Transport's data are roughly correct on deaths. There are estimates from the International Institute for Health Metrics, which suggest that not 150,000 died, but 220,000 died. The Indian Council of Medical Research also gives numbers which are more than 220,000. So it doesn't matter, 150,000 is large enough. But secondly, the data on injuries is completely wrong. In general, in every country, the number of serious injuries are about 20 times the number of deaths, but according to the government, they're only 4 times. So if they say injuries reduced, it's absolutely incorrect. Secondly, the government of India does not know how many pedestrians die, how many motorists die. Their data are completely wrong. We have gone to the same police stations as the government and collected the FIRs, and according to us, and according to the International Institute of Health Metrics, the number of pedestrians may be about 35%, not 13%. It's 3 times the government number. Secondly, they, as far as drinking and driving is concerned, according to government, it's only 2%, but most independent studies done in India show it may be more than 30%. So the cause of death, cause of accidents by the government may also be completely wrong. And lastly, most important, regarding children. Children under 8 years old should not be taught road safety. We have evidence from all over the world, and it's documented, that children under 8 years old should not be taught how to cross the road because they become too confident and more may die. So the only thing young children should be told is to go on the road or cross the road with the help of an older person. So once they've done that for 3-4 years, they'll learn how to cross safely on their own. Thanks very much.
Thank you so much, ma'am. And thank you so much, sir, for adding up to the topic. Before starting the Q&A round, I would like to introduce all of you with a short video on road safety. We believe, as a public health organization, it is our foremost duty to make sure that quality health reaches every nook and corner of the country. This webinar series came out of one such dainty effort. The previous year was very special for a lot of reasons. One major reason was the Road Safety Month instead of week by month. The theme of the year is Sadak Suraksha, Jivan Raksha. SHARP, through its various interventions, is supporting the intervention of the ministry. Here is a short video encapsulating our journey. I request all the attendees to post the questions meanwhile, and the sharpest question will be given a gift hamper of rupees 1000 from SHARP. Please play the video.
मेरा नाम तनु मौर्य है, मैं जीजीआईसी इंदिरानगर पढ़ती हूँ और आज हमारे स्कूल में रोड सेफ्टी का बहुत बड़ा इवेंट था जिसमें हमें रोड सेफ्टी के नियम बताए गए और उसके बारे में कई बातें बताई।
निताशा सिन्हा, प्रिंसिपल जीजीआईसी गोमती नगर, ऐसे कार्यक्रमों का स्वागत करती हूँ और आशा करती हूँ कि शार्प एनजीओ ऐसे कार्यक्रमों को आगे प्रोत्साहित करता रहेगा जिससे बच्चों में एक जागरूकता बनी रहेगी।
यातायात पुलिस की तरफ से मुझे प्रचार प्रसार के लिए लगाया गया है। सार्क और एससीएल दोनों सहयोग कर रहे हैं। विभिन्न जगहों को बहुत ही अच्छा सहयोग है। मैं भविष्य में इनके उज्जवल भविष्य की कामना करता हूँ।
मैं प्रतिज्ञा करता हूँ, किसी पीड़ित की मदद करने से संकोच न करें। दुर्घटना से
Thank you, Ritik, for playing the video. So we start with the first round of questions, Q&A round. And I request the audience to put the question in the Q&A box and raise their hands that we can unmute you for the live questions. So my first question, I request Pratap Maulik to unmute herself.
Hello.
Hello.
Yeah,
Hi,
am I audible?
Pratap.
Yeah, hi.
Yes. Please introduce yourself and the city you live in.
Yeah. Hi, I am Partha Maulik. I am a safety professional and I'm from Kolkata.
Yes, please ask your question.
Yeah. My question is to Dr. Mohan is that how we can improve the behavioral based safety culture apart from the other engineering controls that we already discussed?
This is a very important question you're raising because we have now about 100 years experience in this field internationally. And there are about 100,000, 100,000 papers published on road safety. And our understanding is that it is not easy to change behavior in a short time by education, because people already know what is correct. And this is what I said earlier, if you teach things which they already know, no one will go to school or college. And so, but we forget that as teachers, and we start telling people on the road what they already know. So it makes no difference. So the only way you reduce fatalities in the world, the number one is by having better designed vehicles and roads. Number two is by reducing speeds and alcohol use by enforcement and by having a lot of speed breakers on the road. And because if you have speed breakers on the road and you have roundabouts, then even drunk people can't kill people because they can't drive fast. So it is very, very important to focus on how the roads are made, how much space is given to people, what is the correct way, and enforcement. And on top of that, you can do education. And it is very important to do education to tell people why some law is there. So if people know that if you don't wear a helmet, then you're going to die even at 10 kilometers an hour if you fall. You don't have to be at high speed. and the helmet also saves your neck. And we know from all the countries, including the US, that people don't wear helmets by education. They only wear helmets when it is enforced. So all the parents should know that unless their state governments enforces the helmet law, the children will get killed because they will not wear helmets no matter how educated they are. My own niece, my brother's daughter, is semi-paralyzed because she didn't listen to us.
Thank you so much, sir. I hope, Partha, your question is answered. So our next question from this audience is from Anoma Modak. Anoma, please unmute yourself. Hi, Anoma.
Hello.
Hi. Please introduce yourself and also tell us the city you live in, and then you can answer the question.
Hi, I am Anoma Modak and I am a psychologist. I practice in Kolkata. So my question to the panelist is, how is Indian socioeconomic perspective related to safety behavior in pedestrian? Because we know that what sort of population mostly use the footpath.
Yes, sir.
Brief answer. People behave the same way all over the world, depending on the design of the road and enforcement levels. There's no culture has very little influence.
Thank you, sir. Ilya ma'am, would you like to answer the question?
Yeah, actually, I agree when Dr. Dinesh has already answered. It is enforcement, which is the key. If you have enforcement in place, a lot of things can be addressed, and therefore there is a lot of push on policy and policy framework as well.
Okay. Thank you so much, ma'am. My next question from the audience is from Susan Jatana. I hope I'm pronouncing your surname correctly.
Yes, you are.
Hi, Susan.
Hi, I'm Suzanne Stenita Jatana from Mumbai. I work in L&T, and I would just like to know that do we have any manual or regarding this road safety, wherein a lay person just by going through it, whatever, gets a overview of what are the things that one needs to follow and what are the standards with respect to that. So is there any standard manual sort of thing you can say where one really can refer in for the very minute details?
You can download the World Road Safety Report 2004 from the WHO website for injuries. So if you Google WHO injuries, World Road Safety Report, it's there. And you can download it free. On every topic, you'll get the answer on what is internationally known about that subject and what should be done.
Okay, fine, sir. Thank you.
Thank you so much. So, and my next question is from the audience. I would like to invite Vanshika Soni. Vanshika.
Yes, ma'am. Good evening, panelists. I'm Vanchika. I'm from Jaipur, SRN International School. My question is that many children below the age of 10 do not have the capability or judgment to handle many pedestrian situations. Like, how can we make easy for children to learn about rules and regulation, and how their parents can teach them about that?
They don't need to know about rules and regulations. For the first, up to the age of 8 at least, older people should go with them. And the rules and regulations are for motorists. They won't be driving until they're more than 18 years old. So it's a very simple. What is interesting is the number of proportion of small children getting killed in India is not as high as we think. And we don't know why. So, but main thing is that young children should be accompanied by adults. That's the main thing you can tell children under 8 years old, because children under 8 years old brains do not have computer algorithms to calculate speeds. They learn that by going on the road about 1,000 times. So that takes 2-3 years. And so it is when they go with older people on the road and they keep observing things that the computer program is formed in the brain on how to judge speed. It cannot be taught. So when they are with older people, they're safer, and they're constant. All children are always observing, and so that program is being formed in the brain automatically, and they also see what older people do, and so that's the best way.
May I take this call?
Yes, ma'am. Yes, ma'am.
Yes. That is a very, the question is there, the young children, they don't know about these safety rules, but through this playway method, Nukkad Natak, that slightly awareness should be there that whenever father is leaving the home, should carry this helmet for the safety. And when you're crossing the road, when you're going with the grandparents and parents, please hold the finger of your parents. So these things can be inculcated just to avoid any kind of accident. Through graphic novels also, like Amar Chitra Katha, these things can be just taught to them in a very simple way. So it is having lasting impression on the mind of the child that safety of my family member is very, very important, and they are learning this way. Because we have organized many Nukkad Natak, or maybe in the assembly also, they organize this play. And the children, they got it, and even they convey the message to mummy, papa, to grandparents. And we got the phone calls, they appreciate it. That right from the beginning, you're teaching them that always if you're going to the market, walking to the market, must hold the fingers of your grandparents and parents. Do not run. Okay, so this way we can just teach them road safety points, certain points.
First, I want to add one thing. Actually, the Ministry of Road Transport and Highway, they are publishing different material for the school children, small children. And apart from this, there are so many NGOs. They are developing, materials like video games, comics, books. These are very much essential for the children. And our organization, Forum for Prevention of Road Accident, has published one book, that is Pappu Zebra Road Sense book. So that is very much useful. It has been published in English, Odia, and Hindi. This is a very best referral material for the little children.
Thank you so much, sir. Thank you so much, Bam. So my next question is for Dr. Elia. So, ma'am, it's been 1 year since the Motor Vehicle Amendment Act 2019 has been notified. So, what are the immediate steps that central and state governments can take to strengthen the road safety in India and save lives?
Hi, thank you so much for this question. I think I would like to start first of all by saying that the way Motor Vehicle Amendment Act, when it came, it was covered by all media. It sounded as if it's all about fines and challans, and the whole debate was around that. But there are a lot of provisions within that where it has, for the first time, it emphasizes on the safety of children, where it says that helmets should be there, that child restraint has to be there in the vehicles, where for the first time it has introduced accountability of those who make roads. If there is any fault, they can be held accountable. So there are many first. There is a provision for emergency care and cashless treatment. So this has been there in MVAA. Now it's for the state governments to adopt and form rules and apply that. So that will be one quick step. Already some of the states have started very good measures. Some of the states where the rules have already been applied are 13 states, where UP and Delhi are also those where Save Life has partnered with the government in that. But other states can also follow with the same. We also have very good evidence of some initiatives by government like Tamil Nadu. In state of Tamil Nadu, the system of database maintaining the road crash data and updating it, which is also open for anyone to access, is a very good system. And similarly in Bihar also, they have developed an app. So I think this is how most of the states, if they start applying all the provisions which are there in the MVAA this time, things can definitely change.
Thank you so much, ma'am. Thank you. Now I invite Aliza for the next round of questions.
Thank you, Sharon. We are getting a lot of questions, so I will just try to pick the maximum so that right information can be delivered. I will start with Simardeep Kaur. Can you please unmute yourself? Simardeep Kaur. Am I audible, Simardeep?
Hello. Hello.
Yes, Simardeep.
Good evening to all.
Good evening.
I'm Sima Baba. I'm a teacher. So my question is now, how can we guide the people who cross the red light or with very high speed? Even many school children, every year we organize some road marching or campaigns to awareness about the road safety measures, but still many accidents happens on the road. So how we can guide the other people, you can say?
Anyone from the panelists would like to? Yes, ma'am.
Yes. Just to create this awareness, certainly then every school debate and discussions must take place, and exhibition also. Through the exhibitions, we will let them know that these are the road safety measures. If you are following it, that means you are safe. And impact of road accident also. During annual function, these topics can be taken. That, frankly speaking, this year we have taken this topic of this annual function, that is organ donation, very sensitive, very sensitive. And we invited the parents also. And that according the parents spoke that my child did not follow this particular road safety symbols, and that's why he met with an accident, and really I suffered a lot. So it has been presented very effectively and impacted this way the youth of our school. They realized that how the father is suffering badly. So I am very near and dear to my parents. I must take care of this thing while crossing the road. So through the exhibitions, through debate, through discussions, through playway method, we have to just inculcate certain provision in respect of road safety and impact of road accident. You know, that slowly, gradually it is being followed by the child become very sensitive and start following this road safety measures.
Thank you, ma'am.
Thank you, ma'am. Our next question is from Iqbal. Iqbal Beg. Please unmute yourself, Iqbal.
Yes, ma'am. Yes, ma'am.
Please introduce yourself with the city you live in.
Ma'am, I'm Iqbal from Ahmedabad. I have been associated with Samar Charitable for last 25 years. I just wanted to know, is there any insurance policies for the children regarding in schools? Something like that by the government of India or something like that. It's basically for all the panelists. I'm audible?
Yes. We do have insurance policy for the school going children. Okay. But not from the part of the government, but you can just take this insurance policy. And it is covering, that is, you can say, all sort of perils, right from the minor perils up to this major perils. It is covered. So it is available.
Okay, thank you.
My next question is from Sushila.
Hi everyone. Good evening. Hello. Hi everyone.
Hello, ma'am.
Hello. Hi everyone. Good evening, ma'am. Good evening, all the panelists. Am I audible?
Yes, ma'am, you are audible. Please introduce yourself.
Yes, I am Sushila Sikka. I am teacher in a school in Faridabad. My question is, being as a school teacher at the school level, what policies or what information can be given to the student, or how can they be guided for the safety?
The child is walking to the home, then information should be given that please any parent should come, escorting parent should come. Or earlier it has been just stated that a group of students are coming from the particular society, then by rotation, the parents and grandparents, they can just do this emotional duty. One thing is there. Second, other safety measures we have to see. If parents are coming to pick up, it means separate I-card is also being given that you are coming to pick up the child. Okay. And that awareness should be there. Child should know that I should not run. In respect to the school buses also, that embarkment and disembarkment, they should take care of this thing. And teachers are always there in every bus, in every motor vehicle. When that's any bus is just starting from the school and being parked in the school also. So the parents know this thing. And moreover, now the tracking system is also there. That is a different thing. We are talking about the pedestrian. For the pedestrian, parents can come and pick up the child, but somebody should be there to escort the child. Otherwise, school administration should not allow any child to go independently. Security must be very, very strong. Many times I have seen the children, they keep waiting for their parents. And I'm asking, beta, why you are waiting? It is there, I'm waiting for my parents. Because school security do not allow them to go independently. Your parent will come, will escort you, then you will be going, especially in respect of young children. Otherwise, they should get the permission in respect of child. If child is 14 years old, 15 years old, 16 years old, should get this written permission. Okay, you send the child, but that time also, our discipline in charge, they observe the properly the child is crossing the road also.
Thank you, ma'am, for answering the question.
Thank you, ma'am. Thank you.
Yes, sir.
So it just occurred to me, since we're talking about children, it's very important for everyone to know that in modern cars, which have airbags, children should never ever travel in the front seat. Because, and this has been a law in all countries abroad for the last 20 years. Because when the because the airbag will inflate in a crash even at 15 kilometers an hour. People have the wrong idea that you get hurt at high speed only. Your jaw can break if your car hits something at only 15 to 20 kilometers an hour. So the airbag comes out if your impact velocity is above 15 kilometers an hour. And the airbag moves at more than 60 kilometers an hour. And so if there's a child in the front seat, it gets thrown against the roof and they can die or break their neck. So if there's an airbag in your car, please do not sit in the front seat with the child. And even if there's no airbag, if you keep your child in your lap and you have an accident at 15 kilometers an hour, the child will hit the dashboard, break its neck, and you will come from behind and crush it. So the child will work like a cushion for you, and you will kill your own child. So you should never ever keep children in your lap in the front seat of a car. Number one. And never ever even they should not even sit on the seat if there's an airbag in the car. And it's the car companies are not advertising this. But if you look at the owner's manual in the car, it's written there. So if anything happens, they will say, we told you, but they're not advertising it. So no one knows.
Thank you so much, sir, for this valuable advice.
Lisa, can I just add one point?
Yes, ma'am, sure.
Yeah, just in addition to what has been said, for children who come walking, it can also be considered to give them reflective jackets, because many times when visibility is not there due to fog or due to late in evening, then the reflective jackets will definitely help in being noticed and no one will actually hit them.
Very well said, ma'am. Thank you so much. My next question is from Priyash Gupta. Please unmute yourself and introduce yourself.
Sure, ma'am. Good evening to all the panelists. I'm Priyash Gupta and a student from Rajasthan. So my question is from Usha ma'am that what steps a school can take to solve issue of pedestrian accidents?
Yes, Presh, very good question. It is there that how to control these accidents. The awareness campaign must be there that every school must organize that road safety oriented programs, maybe a talk, maybe that we invite this traffic police personnel, maybe through discussion, maybe through debate, or you can say maybe through exhibition. And in the assembly also, that should be explained. Maybe during this annual function, these topics can be given to the students right from standard 1st to 12th, and they are going to depict very well through this dance drama and talk. And certainly directly or indirectly, it is teaching to the students that what road safety measures we have to follow and how to protect us from this accidents. So, and again, just my request is there to this education department of the state government and the central government that there should be formal subject. Then children should learn about the art of saving the life. And complete manuals should be mentioned in this book in respect of the POCSO Act also, in respect of traffic rules, in respect of this how to protect themselves in the case of fire. That drill should take place by usage of these firefighting equipments, because a child is a nation builder in future. He and she has to take care of the country and he has to take care of the planet. So should be trained right from the beginning. I have seen in many European countries, right from the beginning, they are teaching them this life skills, that how to make use of the machines which are being used at home. So they should not become this victim of this this failure of these machines. They are being taught in many European countries, this dishwashing machines, they are learning how to just wash the clothes. Everything is being taught them systematically. Same thing, a formal subject should be there. That is art of saving life, and that should have the manuals in respect of road safety, manuals in respect of POCSO Act, manuals in respect of this firefighting equipments. In many societies, I have seen very expensive gadgets are there for firefighting. But the children, they do not know about the usage of this firefighting. A fear is there. And they start running, start jumping, rather than utilizing this firefighting equipment. Same thing in respect of road safety. Symbols should be there. Symbols are being given right from this pre-primary section. That is, there's different traffic lights are being taught to them. The red, yellow, and green. They know about this thing. While they are moving with the parents, they know, Papa, now red light, now yellow, get ready, now green, we should start. And many symbols are being given in EVS and social science. That's very good thing, but it should be taken very sincerely and follow-up must take place. So this thing will be very firm in their mind, and this way we can make very safe and healthy society.
Thank you so much, ma'am. And now I'll be asking my last question of the webinar. Is from Saroj Khanal. Please introduce and unmute yourself. Ms. Saroj Khanal. Am I audible to you, Ms. Saroj Khanal?
Hello. Hello.
Yes, yes, yes.
Yes. I'm from here, from Kathmandu, Nepal. And my queries is a person, what will be the best solution the once when the accident caught in a street and the patient and the injured person, how he can take to the emergency in hospital? Because the people don't want to take him immediately because the several queries from the traffic and police. So such type of queries and by the traffic, and immediate the accidents happens, the people who don't want to rescue immediately. So how can we solve such type of problem in this case? And not even for the other pedestrians or even the school bus children also sometimes crossing the roads and in others time also. So what will the best way?
Mr. Vikash, would you like to answer this question?
Just I want to say because that person belongs to Nepal. I think I think the situation here in India is different. So there is a law, that is Good Samaritan law is there in our country. It has been enforced since last 2 years. And in case of any accident, police and you are shifting the patient to the hospitals, the police cannot harass you. Oh, that law is saying that the police, even the magistrate, if you are want to be a witness to the court, to the incident, then it is up to you to decide. So you can voluntarily be a witness, but even the police and the magistrate, they cannot compel you to give witness. So this is the good thing, and I think in Nepal it should be adopted, this type of law, so that people, those who are interested helping the low accident victim, they should be encouraged. So I think.
Just for your kind information, sir, that I've been involved in the road safety awareness camping program with the students and the driver also, until we have done many students and children's awareness campaign program. So in the meantime, what we have suffered that we have also the rule and regulation and law too. But myself, if I find some person in a street who got the accident, and if I want to do the rescue, and if he might be taken to the emergency in hospital, but later when the traffic and police come, and he started asking me to several, because in the spot, because I not have several information regarding that, because I were there just for the rescue only. So this type of problem that we suffer sometimes. So that is just best solution we just want to have.
I understand your point. The thing is that there is a need of awareness program among the police personnel. They should know that is a law, and they should not harass anybody, because you are helping a road accident victim, means you are doing, because after accident the victim is alone. Nobody is there to look after. If somebody is coming voluntarily and helping the road accident victim, bringing to the hospital, he should not be harassed. But many police professionals, they do not know about this law, and so that I think in Nepal they should be taught about this thing.
Thank you, sir. Thank you.
Okay, so let's have a wrap-up question. How can people, sorry, Nidhi, would you like to introduce this question? Nidhi Arora, please unmute yourself and introduce. Nidhi, am I audible to you? Okay, so the question from Nidhi Arora is, how can people be encouraged to use pedestrian path?
How can people be encouraged to use
pedestrian path? Am I audible?
Yes. Actually, there's no need.
Yes, ma'am. Hello. Ma'am, can I audible?
Yes, you are audible, Nidhi.
There's no need to encourage pedestrians to use the pedestrian path. They will use the pedestrian path if it is available, and if it's not dirty, and if it's not if it's not horrible. Most pedestrian paths in India are horrible. They are 1 foot above the ground. How can you climb it and keep climbing down all the time? And there are all kinds of things in the middle. So we should stop blaming people. We should stop thinking and what to tell people. The only people who should be told something is the municipality and the PWD. That first give us a path which is at least 2 meters wide and it is smooth. Yet we should not treat people like idiots. And so first you give them something which is possible and something which is nice. Then if they don't use it, then worry about it. I never walk on a pedestrian path because at my age I keep tripping. I walk on the road. I'm not uneducated. And so it's very, very important to understand these things. For example, if the footpath is only 2 feet wide, And if a lady is walking from there and a man comes from the opposite side, what is the sensible thing for the lady to do? Is to get off the footpath because she doesn't want the man to touch her. So sensible thing for women to do is not walk on the footpath because the men will bother them. So we have to be very realistic. Indians are as good as any German, Japanese, Europeans. We don't need to teach them. We have to first give them the correct thing. And we seem to have a very deep inferiority complex as Indians, that we are bad people. Once we stop thinking that we are bad people, then things will happen. We don't need to teach people how to use the road. We need to teach engineers how to make the road.
Thank you so much, sir. Here we end our second round of questions. Thank you all the panelists for answering the questions and for such valuable views on the subject. Now it's Sharon, would you like to add something? You're on mute.
I would like to thank all the panelists who have joined us today for the wonderful webinar. I personally humbly thank Dr. Dinesh, Mr. Vikash, and Dr. Elia and Usha ma'am for joining us the webinar. We had a wonderful discussion on the statistics, road crash laws, and Good Samaritan laws. And also we had audience from all over the country who actively participated in the webinar. I thank all the audience, and I once again thank all the panelists. Dr. Dinesh, would you like to say something?
No, thank you very much. I think it's very, very useful to have such discussions, and but it's even more important for all of us to start paying, and we should tell our politicians and our officials that unless we have people who know the field in the government, it's very difficult to do something. At present, no state government or the central government has even one road safety expert who's known internationally or nationally. So the police departments and the governments do not have, in the whole country of 130 crore people, not even one road safety expert in the government. So can you treat cancer if there was no cancer expert? Do you go to an actor or an NGO to find out how to treat cancer? You don't even go to an orthopedic surgeon to treat cancer. So please, we have to understand that road safety is also a scientific field. You don't go to even an aircraft safety person cannot tell you most of the correct things for road safety. A railway safety expert cannot tell you the correct things for road safety always. So just like we don't go to an orthopedic surgeon for cancer, we have to start saying that people should read books on road safety which are good, like the WHO book which I mentioned, and understand what is the current knowledge about road safety and what are the few things that we can do. I will close by just saying the first thing which people can do, which already exists in the book, and not talk about things we cannot do. Two things are: everyone in the country should wear a helmet by law, and this the police should enforce. Our deaths will come down by 20, 30,000 next year. If every motorcycle keeps its headlight on in the daytime, deaths will come down by 10,000. Luckily, the government has made a correct law that in the new motorcycles, the headlight comes on automatically in the daytime. And we know from experience that if the headlight is on in the daytime for motorcycles, deaths reduce by 15% because other vehicles can see them. It is not for the driver. And so these are the facts which we know. And we should say that outside every shadi, every bar, There should be a policeman checking for alcohol. The most educated people are drinking and driving after a wedding. Please don't talk about uneducated people. The most educated, the richest, and the most fashionable people are drinking after going to a shadi, going at a shadi and driving after that, and they're very proud. All the cocktail parties which rich people go to, so what are the children going to teach them? This has to be enforced by law. So the reason I've taken a few extra minutes is that please take this subject seriously, like we take cancer, or these days, the current problem, COVID. You don't go to everyone in the country asking them what to do about COVID. So this is, and all of you are young people. I've only got a few years left in my life, but you people have a long time. So please do the correct things, which people have not been doing for the last 50 years in this country, including the Motor Vehicles Act. There are many things wrong with the new Motor Vehicles Act. So I'll stop there because this is not the forum to discuss those things. I've only talked about what we can do, and which is very important because we should keep talking about things which people can do. Thanks.
Thank you so much, sir. Very well explained in very simplest way. So as promised, it is time to announce the winner of the sharpest question asked from the live audience. Sharon, would you like to announce the winner?
Yes, so the winner for the sharpest question is Saroj Kanal. Congratulations, Saroj Kanal.
Congratulations, Saroj Kanal.
Thank you. Thanks a lot.
Yeah, communication team from the shop will get in touch with you. Thank you so much.
Thank you. Thank you.
Now we have a small feedback form in front of you. Please fill the feedback form. The certificates of the webinar will be you will get within 2 days in your mail, and please to know about our programs and projects and the upcoming webinars, please subscribe to www.schoolindia.org. Sharp has also started. Sharp is supporting India's first ever Safe Speed Challenge inaugurated by Ministry of Road Transport and Highways to celebrate the Road Safety Month, a movement to make India's roads safer. Visit indiaagainstrroadcrash.org, take a pledge, or click to the link shown in the poster. The link is also posted in the chat box. I once again thank all my panelists and the audience for joining us today. Thank you so much. Meet you soon for the next webinar on next Saturday.
Thank you so much, everyone, for joining us.
Thank you very much. Thank you very much to the Sharp also for organizing such much needed awakening workshop.
Thank you so much.
All visionary speakers also for the words of wisdom, and thanks to all adorable students for getting the knowledge in respect of road safety measures. Thank you very much. Thank you.
Thank you, ma'am. Thanks a lot.
Thank you. Thank you, sir. Thank you, ma'am.